Hello and welcome to our channel. In today's video we will discuss about appendicitis. So the topics which we will cover in this video are: what is the anatomical location of appendix, what is appendicitis, and what are the various types of appendicitis, and what is the etiology, that what are the basic causes of appendicitis, and what is the pathogenesis, that is a basic pathophysiology of appendicitis. What are the clinical features, that is what are the signs and symptoms of appendicitis, and what are the diagnoses and the investigations. And lastly, we will discuss about the management and treatment and what is a dietary recommended allowance for appendicitis, that how one can control this major problem. So let's start our today's video, that is appendicitis. So first of all, we will discuss about anatomical location of appendix. So let's talk about it. So appendix. So appendix is a narrow blind ended tube which is attached to the posterior medial end of the cecum, which is called large intestine, and it contains a large amount of lymphoid tissues, what is not thought to have any vital functions in the human body. The appendix originates from the posterior medial aspect of the cecum, and it is supported by mesoappendix, a fold of the mesentery which suspends the appendix from the terminal ileum. So this was all about the anatomical location of the appendix. Now we will discuss about the positions of free end of the appendix. So the position of the free end of appendix is highly variable and can be categorized into 7 main locations depending on its relationship to the ileum, cecum, or pelvis. The most common position is retrocecal. They may also be remembered by their relationship to a clock face. So the first position is pre-ileal, which is anterior to the terminal ileum, that is 1 to 2 o'clock face. Second position, post-ileal, which is posterior to the terminal ileum, that is 1 or 2 o'clock face. Third position, subileal, which is parallel with the terminal ileum, that is 3 o'clock face. And the fourth position is pelvic, which is descending over the pelvic brim, and it's 5 o'clock face. And the fifth position is subcecal, that is below the cecum, and it's 6 o'clock face. And the next position is paracecal, which is alongside the lateral border of the cecum, and it's 10 o'clock face. And the last position is behind the cecum, that is 11 o'clock face. So this was all about the free positions of the appendix, and we have also discussed about the anatomical location of the cecum in the human body. Now next we will discuss about what is appendicitis. What do you understand by the term appendicitis? So let's talk about it. So appendicitis is a condition in which the appendix becomes inflamed and is filled with pus and causing pain. This happens when your appendix becomes inflamed, and it can be chronic and acute. Appendicitis is considered as the most common cause of abdominal pain resulting in surgery. If left untreated, appendicitis can cause your appendix to burst. This can cause bacteria to spill it into your abdominal cavity, which can be very serious and sometimes fatal. Now, what are the various types of appendicitis? So basically there are two types of appendicitis. One is acute appendicitis and second is chronic appendicitis. Now let's talk about them. So the first type of appendicitis, that is acute appendicitis. So acute appendicitis is a severe and sudden cause of appendicitis. The symptoms tends to develop quickly over the course of 1 or 2 days, trusted sources. It requires immediate medical treatment, and if left untreated, it can cause your appendix to rupture. This can be a serious and even fatal complication. Acute appendicitis is more common than chronic appendicitis. So this was all about what is acute appendicitis. Now what is chronic appendicitis, which is a second type of appendicitis. So chronic appendicitis is less common than acute appendicitis, and in chronic cases of appendicitis, the symptoms may be relatively mild. They may disappear before reappearing again over a period of weeks, months, or even years. This type of appendicitis can be challenging to diagnose. Sometimes it's not diagnosed until it develops into acute appendicitis. And chronic appendicitis can be dangerous. So this was all about the types of appendicitis. Now next we will discuss about what is the basic etiology, that what are the various causes that leads to appendicitis. So the causes are, so in many cases the exact cause of appendicitis is idiopathic, means it's unknown. So some experts believe that it develops when part of the appendix becomes obstructed, or you can say blocked. Many things can potentially block your appendix, like for example a building of hardened stool, second enlarged lymphoid follicles, third intestinal worms, fourth traumatic injury, and the next is tumors. So when your appendix becomes blocked, bacteria can multiply inside it, and this can lead to the formation of pus and swelling, which can cause painful pressure in your abdomen. So this is the basic etiology of appendicitis, that what are the various causes which are responsible for appendicitis. Now next we will discuss about the pathogenesis or pathophysiology of appendicitis. So let's talk about it. So appendicitis occurs when the appendix becomes acutely inflamed. It's not entirely known why appendicitis occurs. However, it is thought to be due to lumen of the appendix becoming blocked by a fecolith and the normal fecal matter or lymphoid hyperplasia due to viral infections. And once it's obstructed, so there is a reduced blood flow to the tissues and bacteria is able to multiply. And due to the lumen being obstructed, the pressure within the appendix increases, and this reduces venous drainage and results in ischemia. And if untreated, the ischemia can lead to necrosis and gangrene. And at this stage, the appendix is at the risk of perforating. It takes around 72 hours for perforation to occur from when the appendix becomes obstructed. Once the appendix perforates, bacteria and inflammatory cells are released into the surrounding structures. This then causes inflammation of peritoneum, and the child develops peritonitis, which causes diffuse abdominal pains. So this is the basic pathology, basic pathophysiology and the pathogenesis of appendicitis. Now next we will discuss about the clinical features, that what are the signs and symptoms of appendicitis. So let's talk about them. So if you have appendicitis, you may experience one or more of the following symptoms. So first, pain in your upper abdomen and around your belly button, nearby your navel region, your umbilical region. Second, pain in the lower right side of your abdomen. Third, there will be loss of appetite. Fourth, indigestion. Fifth, nausea and vomiting. Sixth, diarrhea. And the seventh symptom is constipation. The next, abdominal swelling, inability to pass gas, flatulence will be there, and there will be low-grade fever. So these are the various signs and symptoms of appendicitis. An appendicitis pain may start off as a mild cramping. It often becomes more steady or severe over time. It may start in your upper abdomen or belly button area before moving to the lower right quadrant of your abdomen. If you are constipated and you suspect that you may have appendicitis, avoid taking laxatives or using an enema. These treatments may cause your appendix to burst. So these are the various signs and symptoms, or you can say clinical features of appendicitis. Now next, we will discuss about the diagnosis and the investigations for appendicitis, which help you to diagnose whether you are suffering from appendicitis or not. So here are the various tests which one can perform if you are suspected that you have appendicitis. So let us discuss about the investigations and the diagnosis for appendicitis. So if your doctor suspects you might have appendicitis, they will perform a physical examination. They will check for tenderness in the lower right part of your abdomen and swelling or rigidity. Depending on the results of your physical examination, your doctor may order one or more tests to check for signs of appendicitis or rule out other potential causes of symptoms. There is no single test available to diagnose appendicitis. If your doctor cannot identify any other causes of your symptom, they may diagnose the cause as appendicitis. So the first test for appendicitis is CBC, that is complete blood count. So to check for signs of infections, your doctor may order a CBC, that is complete blood count. To conduct this test, they will collect a sample of your blood and send it to a lab for analysis. Appendicitis is often accompanied by bacterial infections. An infection in your urinary tract or other abdominal organs may also cause symptoms which are similar to those of appendicitis. So this was the first test for appendicitis, that is CBC, complete blood count. Now the second test for appendicitis is urine test or urine analysis. So To rule out urinary tract infection, that is UTI, or kidney stones as a potential cause of your symptoms, your doctor may use urine analysis, and this is known as urine test. A third test, that is pelvic examination in case of females. So if you are a female, your symptom might be caused by PID, that is pelvic inflammatory disease, or an ovarian cyst, and another conditions affecting your reproductive organs. To examine your reproductive organs, your doctor may perform a pelvic examination. Now next test, that is abdominal imaging test. So to check for inflammation of your appendix, your doctor might order imaging test of your abdomen, and this can also help them identify other potential causes of your symptoms, such as an abdominal abscess or fecal impaction. Your doctor may order one or more following imaging tests, that is, first one, abdominal ultrasound, second, abdominal x-ray, third, abdominal CT scan, and abdominal MRI scan. So these are the various investigations, various tests which are used for the diagnosis of appendicitis. So by performing this test, one can know whether they have appendicitis or not. So this was all about the investigation and diagnosis. Now next we will discuss about the management part, which is a very important part of this video, that how one can manage appendicitis. So let's talk about it. So there is no sure way to appendicitis, but you might be able to lower your risk of developing it by eating a fiber-rich diet. Although more research is needed on the potential role of diet, and appendicitis is less common in countries where people eat high fiber diets. And foods which are high in fiber includes fruits, vegetables, lentils, split peas, beans, and other legumes, oatmeal, brown rice, whole meat, and other whole grains. Add fiber by sprinkling oat bran or wheat germ over breakfast cereals, yogurt, and salads. Cooking or baking with whole wheat flour whenever possible. Swapping white rice for brown rice. Adding kidney beans or other legumes to salad. Eating fresh food for desserts. And if you undergo surgery to remove your appendix, your doctor may prescribe antibiotics and pain relievers to support your recovery. In addition to taking medication as prescribed, get lots of rest, drinking plenty of fluids, go for a gentle walk each day, in fact every day. Avoid strenuous activities and lifting heavy objects until your doctor says it's safe to do so. Keep your surgical incision sites clean and dry. So this was all about we have discussed about the anatomical location of appendix, what are the various types of appendicitis, and what are the various causes, what are the clinical features, that is signs and symptoms, and what is the basic pathogenesis of appendicitis. And lastly, we have discussed about the investigations to rule out for appendicitis, and we have also discussed about the management part, which is very important, that how one can manage appendicitis. So that's all for today. See you guys in our next video, that is how one can manage appendicitis by using homeopathic medicines. So we will discuss all the top homeopathic medicines for appendicitis in the next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. And yes, stay safe, stay healthy, stay tension free. Always meditate every day and exercise daily for at least 1 hour. And thanks for watching our video.